Hello, my name's Dr. Borborygmus, and I've been studying Graves' disease since it was first discovered in the early 1900s. Don't you dare ask how old I am. It was first discovered by Graves, Perry, and Basedow. This syndrome is caused by a genetic predisposition to an autoimmune response involving a disorder in the circulating IgG antibodies. The malfunction causes the antibodies to bind to the TSH receptors, which leads to continuous, uncontrolled thyroid stimulation.
But how?
This results in follicular hypertrophy and hyperplasia, which results in thyroid enlargement. This causes excess hormone production, also known as hyperthyroidism. Graves' disease is the most common cause of hyperthyroidism. It takes up about 60 to 90% of all cases. Triggers include stressful life events, recent birth of a child, infections, and smoking. Women are 10 times more likely to be affected than men, and the disease usually presents itself between 40 and 60 years of age. Unlike primary hyperthyroidism, other body systems are also affected and occurs in about 30% of cases.
Tell us more.
This includes dermatological changes, neurological changes, and ophthalmic changes, including exophthalmos, periorbital edema, exposure keratitis, and ophthalmic lag. Other signs and symptoms include heart palpitations, tachycardia, weight loss, increased irritability, enlarged thyroid goiter, heat intolerance, exercise, excess sweating, clubbing of the fingers and toes, sleep disturbances, tremors, and menstrual irregularities. Diagnosis of Graves' disease is based on the family history, clinical signs, and lab results. The use of Doppler ultrasonography helps the doctor to visualize the gland. Also use levels of thyroid hormones and antibodies in the blood to come to the diagnosis. Can also use radioactive iodine to see how the thyroid is functioning. Treatment can vary greatly depending on the region the patient lives in, the access to suitable facilities, and the expertise of the physician. Initial treatment usually begins with medication therapy, including drugs methimazole or propofol. Methimazole is generally used because it only needs to be taken once daily and has less side effects. Radioactive ablation treatment is usually the second line of defense. The medication must be stopped at least 7 days in advance before starting this treatment. This process involves injecting radioactive iodine, and it infiltrates the thyroid gland, which reduces thyroid secretion.
That's a mouthful.
The goal is to reduce the reoccurrence of Graves' disease by inducing the patient into a hypothyroid state, which is easier to medically manage. If all other treatment fails, or if the patient is unable to take the medications or is pregnant, surgery becomes a viable option. A full thyroidectomy is performed, which means the patient will have to take thyroid supplementation for the rest of their life post-procedure. Other adjunctive treatments include topical glucocorticoids, selenium, beta blockers, thyroid supplementation, iron, and selenium. Unfortunately, a disproportionate number of thyroidectomies are performed on patients who live in lower socioeconomic areas or are underinsured, not insured, or have Medicaid. This is done without pursuing other options first, like medication therapy or radioactive iodine. This is due to the fact that it requires less post-treatment surveillance. Graves' disease can greatly impact a patient's quality of life and mental health. The dermatologic, neurologic, and ophthalmic disfigurements can cause a person to not want to go to work and have an impaired social life. This causes severe visual and manual disimpairments. Is that a word? Additional considerations need to be made in the dental setting. Children with Graves' disease can experience premature exfoliation of their primary teeth and premature eruption of their permanent dentition. Osteoporosis Osteoporosis can occur in adult patients, which can help progress existing periodontal disease. Patients also have an increased risk of caries development and can maybe report burning oral sensations, mostly involving the tongue. It is important that the dental clinician consider these effects and talk to the patient about appropriate home care and scheduling appropriate recall intervals. Additional caution needs to be taken with patients that have been treated with radioactive iodine. The radioactive components can be excreted in their body fluids, including saliva, for upwards of 3 weeks. A medical release from the patient's physician is of absolute need before beginning any treatment. Now, on a serious note, Graves' disease affects about 3 to 5% of the total population. Unfortunately, there is no cure or perfect treatment currently in use. All methods currently being used simply address the symptoms of Graves' disease and not the underlying cause. More research and advanced studies need to help find a more effective treatment protocol.